Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And I'm excited about our special guest today. We have Rita Zamora, who's the founder of Connect90, a customizable social media program helping dentists with content ideas and tools to save time and get better results. A former treatment coordinator, she graduated magna cum laude from the University of Colorado with a bachelor's degree in business and marketing, and has over 20 years of experience in the business of dentistry. Rita, thank you so much for being on the podcast.
Thanks for the invite. Happy to be here.
Well, there's a lot going on in the whole social media sphere right now, and you have your finger on the pulse of that. So what are you seeing when it comes to practices use or not use of social media right now?
Mm-hmm. Yeah, things change every day. And the one thing that we're seeing that's been consistent for dental teams over the last, I would say, since COVID really, is that they're challenged with time and having enough team and resources to be able to manage social media.
Yeah, I think that if you ask 10 dentists right now what the biggest barrier in their getting their practice where they want it to be, it really comes down to something involving the team for the majority of them, for sure. And there's no reason that social media would be any different, but it is a crucial thing for patients to have. It's a little bit odd asking somebody who's does social media say, like, this isn't something we want to let just drop the ball on, right? So could you talk a little bit about the importance of having a social presence?
Yeah, I think a lot of dentists understand today. If we were talking about this 10 years ago, we'd still be trying to prove to people how important it is and why you need it. And I think today people just know so many people are spending time on social media. And whether it's younger generations or more mature generations, people are active on social media and you want to have a presence there. People know that's where they go to get current information about your practice. They know your website's going to be mostly static and not a lot of current information. So I think dentists know that they need to be present on social media, not just for marketing and getting new patients, but also just to have an active presence to let people know that your business is alive and thriving. With that said, they also know it's important, but how am I going to manage it with all the other things that we have going on?
I'd love to get your opinion on the thought that I had just now, because we do websites at Tooth Apps. I firmly believe, like you said, the website has a different role than it did 10 years ago. 10 years ago, it was like a business card for your practice. And now I believe it's the digital front door to your practice. So having the right technology on your to be able to convert patients, people just want to pay their bill. Your team members aren't just overwhelmed with social media. Like, why have people taking payments over the phone if they can just do it from your website? And so the role of the website has changed. Obviously, there's still a marketing component because it has gone more to like how we interact with patients. Whereas social's kind of taken up that piece that the website used to take up. Like when people are going, this is my stream of consciousness that I would like to have you either affirm or reject that if people really want to get the culture of your practice, they're not going to get it from looking at the About Me section of your website. They're going to check out your social pages. Is that correct?
Yeah, completely correct. And I love what you said about the website really helping with a lot of that transactional type of functionality that patients need, whether it's getting payments or knowing that they're going to go to the website to be able to schedule an appointment. Hopefully, they're offering online appointments. And so we're still driving a lot of traffic from social media when possible back to the website for that sort of thing.
Yeah, that's great. So what tips do you have for practices that are looking to, maybe they don't even know the social media platforms that like where their patients are or the type of content that they should be producing?
Yeah, the top three right now are Facebook, Instagram, and then it's not a social media platform, but on Google Business, your Google Business profile where your map and reviews live, you can post content there. So you should post content there at least every 7 days. Every 7 days, Google archives that content. And so that's a great place for you to reach new patients. Google just expands the size of your Google profile when you post content there. And many more teams now are starting to post to LinkedIn company pages when they're trying to reach out to local folks for hiring. It's a great place for you to have a presence, so you don't have to post there all the time, but at least, like you said, be able to share a little snippet about your team, about your culture, what's special about your practice, so that you can attract local top talent in that way. And then there's a lot of other social media channels, Snapchat and TikTok, which has its own issues right now, just waiting to see if the other shoe is going to drop, what's going to happen with that platform right now. So I would say the main ones that you want to focus on, the main platforms, are Facebook, Instagram, and having a LinkedIn company page and posting content to your Google profile. And with a good content calendar and scheduling tool, you can take care of all of those channels.
Yeah, it's interesting because like when you talk about a decade ago to now, it was not quite a decade ago, but it's probably 5 or 6 years ago that I started podcasting. And at the time, doing a 10, 15-minute podcast was relatively rare. I didn't know, like, most people are doing these really long form ones. And now
Yes.
it feels 10 minutes is too long because of the whole Instagram Reels and TikTok realm. 12 seconds is better than 12 minutes. And is that kind of what you're seeing? Because video does seem to be and the reason why I'm asking these is that it's been a long time since I've done anything to do with social media for a dental practice, because I haven't really I sold my practice about 5 years ago, which is a lifetime in this arena. But I've been doing social media for Tooth Apps and Upgrade Dental and other technology platforms, and the audience is very different, but really the techniques, I'm guessing, are the same. Like short form videos, probably very good versus a generic image that says like brush twice a day or whatever. Is that true?
Exactly. Yeah, that's totally true. The top types of content formats are, number one, short form video, just really brief videos, like 15 to 17 seconds is a sweet spot right now. You have 1 to 2 seconds to capture people's attention with short form video. And for as far as engagement, though, one study, I think it was Hootsuite, they surveyed or actually looked at a bunch of information that was posted on their platform and found that carousel posts, which are those posts on Instagram where you have a number of different photos and or videos mixed in, can be really the best type of post for engagement. So short form video, carousel posts, and we do still see photos that perform really well. And just like you said, the prepared graphics that have just a lot of text on them or don't have people on them just don't really perform very well. And in fact, can hurt you, because when you're not getting visibility and you're not getting engagement over time, it just starts to tank and you're getting less and less reach and less interaction. And then the social media platforms are going to say, why should we even show your content to anyone? Because nobody's responding to it.
I think that most dental practices, they probably, like you said, they recognize the need for having a presence and keeping up to date with social media, but they don't have, oftentimes I think it's delegated to the one person that's younger, that they go, oh, that person like is on social media. Like, and being on social media personally is very different than being able to promote your practice on social media. So how would you recommend that practices address the need? Because if you're going to be creating carousel images or short form video, these don't just produce themselves, right? So how would you
Yeah.
recommend that a busy practice that's overwhelmed with the needs of delivering care address this?
Yeah, and I actually get calls about this. I just had a call yesterday with an office manager that said we need some kind of an approval process in place, because we gave one of our team members free reign to post whatever she wanted. And there were a lot of skits and fun videos that were funny, and some of them were crossing the line of what they felt comfy with their branding. I think this is an important conversation for the dentist to have with their team member, just a little bit about how you want to be perceived. What is your brand? It's really important. What is crossing the line? What do you think is good to share that's going to represent your practice in the way you want to be perceived, not just that's funny and entertaining for everyone, because everybody has a different sense of humor. Everyone has a different opinion as to what they feel is appropriate or not. And so I think that's an important conversation to have today, is what is our brand and how do we want to be perceived? And then if you're doing social media for marketing, is it's really important to think about what are those treatments that you want to be known for. It's really funny because teams have trouble coming up with ideas for content, but really the more that you can niche and the more that you can really focus on what it is you want to be doing more of, whether it's clear aligners or dental implants or smile makeovers or whatever, bread and butter dentistry, doesn't matter, but you should be posting about that consistently. And that's where a lot of team members miss the mark.
Gotcha. Yeah, I feel, and this is again what's in my brain that I'd like you to either validate, disprove, or address, that a lot of people, like personally, or they feel like, oh, you want to be really your authentic self on social media. You hear a lot, and let your freak flag fly or whatever, which is great if you're like
Your
trying
vibe
to,
attracts your tribe.
yeah, exactly. But not necessarily for dental practice. I feel like there's not, as far as I'm aware, there's not like a beatboxing dentist, right? But let's just use it if there
There
was. It's like
probably is out
there
there,
probably is,
though.
and I
There
apologize
probably-
if I'm not making a judgment and that person. But if there probably is a beatboxing dentist that has 100 million viewers, right? Everybody's like, that person's doing social media correct, and I'm like, so what if you have viewers? What you're trying to do is, if for your dental practice, unless you're just in it to cast your vibe out to the universe, which great, good for you. But if
Right.
you're looking to drive action for patients so that either they're taking better care of their teeth or they come to you for their treatment, right? It's not about the number of likes. It's about what people are actually, the brain space you're engaging with people. So it's not even really a branding, if you think about it from my perspective, because branding is how people feel about your brand, like how they feel
Mhm.
about your practice. And in social media, for driving people to us for one thing or another, unless you're, and maybe it's both, maybe you're looking to engage with your existing patients so they could have a specific feel. But if you're driving people to your practice from a marketing perspective, we really want to just get out there that we do this and we're really good at it. Is that
Yeah.
true?
For sure, 100%. And I think it's not just for new patients, but also existing patients, because your existing patients are going to take time and really research you before they write out, I'm going to go ahead and get my dental implants. I'm going to sign on the dotted line to get this huge treatment plan done. Before they do that, they're going to really want to do their own homework and see what other implants have you placed, what other clear aligners have you done? So they're doing their own homework and research and due diligence. So I always say social media is not just for new patients, it's for your current patients too, for that case acceptance. And it's really important from that aspect, because when I used to work in a perio practice years ago, we used to get referrals from the general dentist to do the surgical placement of the implant. And then when we'd go to refer the patient back to the dentist, the patients would say, we just want to stay here because you guys know how to do implants, and I don't want to go back to my dentist because they don't do implants. And we're like, yes, they do. That's why they sent you here. And so your patients may not even know that you actually do these treatments. And social media is a great way to inform them about that too.
Oh, but yeah, I remember a time when a patient came in the practice and they had just had really nice veneers done. And I was like, they didn't know that we could do that. We did veneers at the practice.
Oh,
I was like, oh man, we just totally whiffed that one, right? That was one of those things where it only happens once, right?
yes.
Yeah, we definitely that was a learning experience. Um,
Yeah. And I wish
well,
it
so
only happened once, but actually we heard that happen several times in the specialist practice. So it means there's a lot of patients out there that have no idea what you have to offer, because they're not seeing every post that you put out there. They're not reading everything that you have in the office when they go into your office. So you only have these few opportunities to educate and inform your patients, and you got to take advantage of all of those opportunities.
so when now that offices are, you know, basically overwhelmed with tasks, and so how do you help them minimize the effort to get the maximum results?
Mhm. We have our Connect90 program, which they could use our content calendar and scheduling tool or any other content calendar and scheduling tool that they want, where we provide different content suggestions. They're a mix of practice building content and some more social type of content. And then the content calendar and scheduling tool allows them to build that content in this platform, and then they can make copies of that content and customize them for the different channels: Facebook, Instagram, Google Business, LinkedIn company pages. And then all the content gets published from that one platform to these different channels. So it allows them to really look ahead on their calendar and say, are we talking about clear aligners? Are we talking about our membership plan? If we want to make sure we're letting people know about our dental membership plan, are we talking about whatever those procedures are that you want to be known for, or certain special events that you have going on in the office? And so having a content calendar and a plan for every month helps them to actually save time versus like just being spontaneous and just posting whatever entertaining thing off the hook. And so this really helps them to save a lot of time, but also gets them better results because they're actually seeing what it is that they want to post about. And then they can do fun, spontaneous things in between, but at least they have a strategy every month.
That's great. Where can people go to find more information?
And they can visit our website at Connect90.com, and we're happy to offer a 30-day complimentary trial with no obligation to anyone that mentions your show when they come visit us.
Oh, thank you very much. Yeah, that's great. And Rita, thank you so much for being on the podcast. Appreciate it.
Thank you.